Hi, everyone. So we're just going to wait for a few more people to arrive and then we'll get started. But I'll just start off with introducing myself. So my name is Kirsten. I work at Medical Marijuana Consulting. I'm the Assistant General Manager there, and we work in conjunction with the Women's Cannabis Clinic to provide not only medical cannabis authorization, but we also help educate patients and their families regarding medical cannabis. We provide a lot of patient support, and this evening we're just going to chat a little bit about cannabis as it applies to women's health. So as soon as everyone's here, we'll get started. Just in case you have never used Zoom before, you can ask questions as I go. I will come around at the end and give everybody an opportunity to ask questions then. But if you do have questions during the presentation, feel free to send them to me and I will answer them at the end for you. Thank you so much for joining us tonight. Okay, so we're going to go ahead and get started. If you're joining us on Facebook Live, unfortunately, I'm not able to monitor the comments at the same time. So I have included the link to Zoom so that you can ask me questions directly. If you do have any questions afterwards, you can always come and find me on our Facebook closed community, and I'd be more than happy to assist in any way that I can. So like I said, this evening, we're going to be chatting about cannabis and women's health. So we're going to go over just the basics of cannabis, what it is, where you get it from, how you can get authorized, women's health and cannabis, so how you can use it for specific issues that are prevalent in women. We're also going to talk about the whole health approach, so integrating cannabis into your everyday life. We'll also talk a little bit about our services, followed up by a Q&A period. So for this, you can actually use the buttons on your screen for these questions. So the first question is, currently in Canada, the regulations specify is that you can, medical cannabis is legally purchased through Health Canada regulated licensed producers. Recreational cannabis is legally purchased through provincially regulated storefronts and online stores. You can purchase cannabis, recreational or medical, from wherever you like, and it's legal, either all of the above or none of the above. So the correct answer is actually both 1 and 2. So you can currently purchase medical cannabis legally through Health Canada regulated licensed producers, and you can also purchase recreational cannabis legally through provincially regulated storefronts and online stores. So the current regulations are called the Cannabis Act. It was brought into the Access to Cannabis for Medical regulations. It allows for the purchase of both dried cannabis and cannabis oil through health regulated licensors. It also allows for personal use production, or the Cannabis Act also includes the new regulations for recreational cannabis. So currently now what you're able to do in Canada is purchase up to 30 grams of recreational cannabis or cannabis oil at any one time from the provincially run OCS if you're in Ontario, or your province's designated provincial dealer. One thing you do get asked about is, what's the difference between recreational and medical cannabis? Well, the biggest difference is that medical cannabis specifically, having your authorization for your medical cannabis legitimates it as a form of medical treatment. So you have to see a doctor or a nurse practitioner in order to get prescribed medical cannabis, but it also starts the documentation process, including WCC will track and tailor the medical cannabis prescription to your needs. So we're here to help you pick out all the strains that you need. You can have a check-in with our RN or our nurse practitioner to make sure that you're on the right track and taking the strains that are actually going to be effective for what you're looking for. The possession limits are actually also higher for medical cannabis prescriptions. So the way that it works for medical cannabis prescriptions is you are allowed to possess on your person at any given time 30 times your daily amount. So if you were given a prescription for 1 gram a day, that means that you're allowed to possess 30 grams. If you were given a prescription for 2 grams a day, it's up to 60 grams. The only limitation on that is you cannot be in possession of what your prescription is at any given time. But this also means that you can possess 30 grams of recreational cannabis as well as your prescription cannabis. It just has to be in the right containers, and you need to make sure that you have the documentation on you. There's also a lot more access to strains and products through licensed producers. Specifically in Ontario, a lot of people were left waiting weeks, if not months, for their OCS order to actually show up, whereas the licensed producers are usually able to get it shipped to you within 3 to 5 business days. The pricing for recreational cannabis is also significantly higher in some cases. I know that I saw a couple of products on the OCS that medical patients pay a third of the price for, if that. Licensed producers also absorb a lot of the extra taxes that are being put onto recreational cannabis. So in the end, having your cannabis medically makes a lot more sense, not just because you're getting access to things that you need, but it's also a lot cheaper that way as well. So just another question. So if you want to type your answers in the chat, currently in Ontario, the following practitioners can authorize a patient for medical cannabis. So a family doctor or specialist, a chiropractor, a nurse practitioner, a massage therapist, a naturopath, or all of the above. So just let me know which ones you think are the correct ones that are able to authorize. So the answer is actually both 1 and 3. So a family doctor or a specialist can authorize for medical cannabis, and nurse practitioners in Ontario are actually able to authorize as well. Chiropractors, massage therapists, naturopaths, other sorts of alternative healthcare practitioners are unfortunately not able to authorize, but we'll get into that in a second. So only nurses and doctors are able to authorize for medical cannabis in Canada. This is because they have the specialized extra to their license that allows them to prescribe narcotics. So they have to be allowed to prescribe narcotics in order to authorize for medical cannabis. These authorizations need to include specific pieces of information. So if you look at this example here that I've included, the big first thing that you'll see is it includes all of their contact information, as well as their license number, the provinces that they're able to practice in, as well as the business or consultation address, to include the legal first and last name. So it can't be a short form of a name or a nickname or anything like that. It's legally their name. It also includes the date of birth, their dose, and the dose is written in grams per day. This is because this is how it is dispensed to people, even in oil. So if you have issues converting it, if your prescription is written in grams per day, it's really important that you get in touch with your cannabis educator to sort that out. The duration, it's usually written in days or months, depending on how long it is, but it cannot exceed 12 months as per the regulations. There are some extra information pieces included on here as well. Things like a THC or CBD restriction, depending on the age of the patient, as well as recommendations. So in some cases, the nurse practitioner or the doctor will say, well, I want them to start with CBD oil in the daytime and THC in the evening, or they'll write more specific instructions like I have in this example here. This is all to let the licensed producer know exactly what your doctor is authorizing you for. The recommendations and THC restrictions are generally only taken as a guideline. In most cases, you still have access to a lot of products, unless it's a very hard, absolutely they should not be having THC, like in the cases of some pediatric patients. This authorization is also sent directly from the authorizing healthcare practitioner's office to the licensed producer. This is to ensure that they're getting the original medical document directly from the authorizing healthcare practitioner to ensure that it hasn't been tampered with. And it's also used for verifying. So every single authorization that a licensed producer gets, they have to verify that. So it's important that it goes directly from the doctor or nurse to the licensed producer so it can be verified. Licensed producers versus dispensaries. So licensed producers, as I was mentioning before, is the only legal way to purchase medical cannabis in Canada. They are highly regulated by the federal government, and they only sell products that are within the current regulations. So they only sell things like cannabis oil, cannabis sprays, which are also oil, dried cannabis. They'll sell vaporizers and things like that. And so you're able to order over the phone or online from a licensed producer. You're not actually able to go to the production facility, but it's shipped directly to you. And again, like I was saying, it's usually within 3 to 5 business days from the date that you order till the date that you actually get your cannabis. Dispensaries are completely illegal and unregulated. So if you're going into a dispensary and they're telling you that it's 27% THC, there's no way for them to actually know that. And there's no way for them to actually verify that that's the strain that they're giving you either, because it is impossible for them to get tested due to the fact that they are an illegal source of cannabis. Because they're unable to test their products, they're also unable to test for things like pesticides, mildews, molds, bugs, and other types of pests, which really doesn't make it a safe product to consume. They also sometimes sell products that are outside of the current regulations, so things like edibles or shatter, hash, those sorts of things usually end up in online and storefront dispensaries, and those are actually not legal currently. Edibles you can make yourself and possess legally, but it does have to be made with legally purchased cannabis. So we'll get into a little bit of what is actually in cannabis. So the main non-psychoactive component in medical cannabis is called CBD. This is something that a lot of chronic pain patients and anxiety patients use, just because you don't get the intoxicating effects like you do from THC. So it's known for its anti-inflammatory and muscle relaxant properties, which is great for pain and inflammation. And it's recommended for its daytime use just because it doesn't sedate you and it doesn't give you the same euphoric effects that you get from THC. In some cases, some people might feel a little bit sedated by CBD, but again, this is something you need to speak with your doctor about. It's recommended for clients with chronic pain, anxiety, inflammation, PTSD, and headaches, as well as many other symptoms of chronic illness that you experience all throughout the day and you're looking for some relief for. THC is the main psychoactive component in medical cannabis. It's known for its euphoric and sedative effects. So generally what's recommended is use in the evening through to night because it can sedate you. Clients are considered impaired while using THC, so it's not recommended to drive or operate heavy machinery. Now, when they work together, CBD and THC do something very interesting. It's a synergistic effect. So CBD can actually help to mitigate some of the psychoactive effects from the THC. So you'll see strains that are 1-to-1s or 2-to-1s or 5-to-1s that are actually also meant for afternoon use. But again, if you're consuming THC, you are not recommended to drive or operate heavy machinery. So another common identifier that you can find on licensed producer websites is INDICA and SATIVA. Now, a lot of the times when clients are asking, well, what's the biggest difference? The biggest difference is when you think INDICA, think couch. It's known to be sedative. It's known for the couch lock feeling. Whereas sativa is more of a cerebral, inspires creativity and concentration sort of type of strain. So those will, depending on what symptoms you're treating, it'll determine what type of a strain you're looking for. A higher THC indica strain, it will assist with symptoms of sleep disturbance and stress, whereas a higher CBD indica strain will assist with things like muscle relaxation, inflammation, and anxiety. Sativa, the higher THC sativa strains will assist more with appetite, but can also cause more symptoms of anxiety. So if you do have an anxiety disorder, you need to be really careful when you're using sativas and just make sure that you test out little bits at a time to make sure that it's not going to cause you to have more anxiety. Higher CBD sativa strains aid with things like concentration, appetite, and inflammation. There are a lot of strains that are just straight up hybrids, so they do have a little bit of each type in them. And depending on how you react to each of those things, that will determine how you're going to react to a hybrid. But again, it's always important to start low and go slow when you're trying a new strain or oil. So I got another question for you guys about the methods of ingestion. So currently, which of the below methods of ingestion are typically recommended by healthcare practitioners? Is it 1, smoking, 2, vaporization, 3, cannabis edibles or oil, 4, topical applications, or 5, all of the above? Just check all that apply. So currently, the 2 most recommended are both vaporization and ingestion, so edibles or cannabis oil. Although more practitioners are starting to recommend topical application as licensed producers are coming out with base creams and things like that. So topical application is actually available for clients. So let's talk a little bit about how each of these affects you differently. So we'll start with inhalation or vaporization. The onset is the quickest out of all of them. It's usually between 5 and 15 minutes, depending on the strain and how high your temperature is set and things like that. You will expect to feel the peak effects within 30 minutes to an hour, and then generally it'll last for 2 to 4 hours. So this sort of a method of ingestion is meant for an increase in acute pain. It's meant for like short-term symptom relief. It's not meant for long-term symptom relief just because it doesn't last very long in your system. Ingestion is the next one, and this is what most of our clients are recommended just because it does last so long in your system. So the onset is a little bit slower. It's usually between 1 and 1.5 hours. You can expect to feel the peak effects within 2 to 2.5 hours, and the duration is usually for 6 to 8 hours. So a lot of clients will use CBD oil throughout the daytime and only have to take a couple of doses to assist with their pain relief or their anxiety symptoms, just because it does stay in your system for such a long time. As far as topical application goes, the onset and duration are dependent on the base that is used. So if you have something that has a good transdermal base, it'll help get that CBD or THC into your skin a lot faster. If you're just using a regular body cream or something like that to mix your cannabis oil into, it'll take a little bit longer just because it does have a little bit more of a hard time getting through your skin. The duration is totally dependent on the strain, the potency, or how strong it is, as well as personal body chemistry, but this is generally accepted as how long it lasts for, how long it will take to kick in, and those sorts of things. Okay, so next we're going to take a look at women's health and cannabis. So I've got another question for you guys. What are the differences found between men and women regarding cannabis use? So for this one, you just need to select one. So for the first answer, it's the likelihood of adverse reaction to cannabis, sexual appetite, tolerance development, amount and frequency of consumption, illegal cannabis sources, or their differences between the reasons for medicating, sexual appetite, tolerance development, likelihood of using cannabis recreationally, or is it the third of the reason for medicating, likelihood of adverse reaction to cannabis, sexual appetite, tolerance development, and amount and frequency of consumption, or is it none of the above? So the answer is actually 3. Those are the most common places where we're going to see differences in men and women. We're going to chat a little bit about that now. So from some studies that have come out over the years, it's been found that women are more likely to experience the dizziness after consumption of THC. Women are also more likely to experience an increase in their sex drive through the consumption of THC. Women are actually more likely to develop tolerance quickly and become desensitized. So in some cases, you might see a lot of the female patients in a clinic are consuming at higher doses, and that could be due to the fact that they are female. And they're more likely to use cannabis to cope with anxiety symptoms and stress symptoms. Now, on the male side of things, men actually consume cannabis at a higher rate than females do. So there are much more men out there that use cannabis than women. They are more likely to get the munchies, actually. So that's what that second point means there. There is a possibility that they will have better results with pain relief from cannabis. But this was, again, it was just a small study. So we'll have to see where that goes with future studies. Men actually experience a decreased sex drive through the consumption of THC, and which is interesting just because it's the exact opposite to what women experience. And just to check your knowledge again, what are some of the eligible conditions or some of the conditions that make you eligible to get medical cannabis authorization? So we have chronic pain, sleep disturbances, anxiety, depression, Crohn's, IBS, polycystic ovarian syndrome, premenstrual dysmorphic disorder, PTSD, multiple sclerosis, cancer-related chronic pain. And is it all of the above or none of the above? And the correct answer is actually all of the above. These are just some of the eligible conditions or some of the conditions that might make you eligible for medical cannabis authorization, and there are quite a few more. So there are a few ways that, or a few symptoms that cannabis might be helpful for treating specifically in women. So for premenstrual symptoms, it's been shown a lot that CBD can assist with lessening the severity of cramping through the muscle relaxation in the uterus, which is very helpful. There are a lot of women out there with things like PMDD that suffer debilitating cramps and nausea because they're menstruating. So something like CBD they might find helpful. For menopause symptoms, it can assist in treating the sleep disturbances that are associated with menopause, and the CBD THC combination can sometimes assist with mood regulation during menopause. Fibromyalgia and autoimmune disorders are more common in women as well, so it's something important to consider. So CBD can, in some cases, assist with pain management as well as inflammation, and THC can assist with sleep disturbances associated with pain. For endometriosis, CBD can assist with the inflammation and some digestive issues, if that's one of the symptoms that you suffer from. It can also assist in some cases with the sleep disturbances due to the pain or just the sleep disturbances that are caused by endometriosis, and assist in increasing appetite. And something that a lot of women struggle with but don't really talk about is a low libido and or pain during sex. CBD can assist with treating pain, and THC can assist in increasing the libido in women. So the whole health approach, this is something that WCC is very proud about, and something that we're really starting to focus on is how to integrate cannabis into your everyday routine. How can it make you live the best life that you want to live? So we're just going to look at a few examples of that. So just to check your knowledge, cannabis and lifestyle. What are some of the ways that cannabis can be incorporated into a healthy lifestyle? Medicating before and after exercise to increase performance and help with recovery. Medicating before yoga to assist with concentration and relaxation. And medicating before or after eating to assist with appetite and digestion. So select all that apply. So the answer is actually all three. Cannabis can help and can be incorporated into a lot of aspects of your lifestyle in order to assist in different ways. So incorporating cannabis into yoga. So incorporating cannabis into your yoga practice can assist with the relaxation, concentration, and muscle relaxation to help you stretch farther, recover quicker, and remain in the moment and focused. Now, on the other side, I have included some strain suggestions, but it's important to keep in mind that if you are going to try any new strains, you need to speak with your healthcare practitioner to make sure that these are suitable for you. Next, we'll take a look at cannabis in food. So incorporating cannabis before or after your meals can aid with appetite stimulation, relaxation, and decrease the chance of an adverse reaction to cannabis. Edibles are also the preferred method of consumption for many medical cannabis patients due to their long-lasting effects that aid with anxiety, sleep, PTSD, and pain. So a lot of patients prefer to use their cannabis in an edible form just because it is discreet. No one has to know if you're taking cannabis that way, but also because it does last for a really long time. Again, I've included some strain suggestions here for you guys. So incorporating cannabis into your exercise regimen. Cannabis can add a great deal to both pre and post-workout routines. Not only can CBD assist with muscle relaxation, but it might help some recover faster afterwards. CBD is known as a bronchodilator, meaning that it opens up your airways to increase oxygen intake and increase performance during conditioning and endurance workouts. So what it does is it allows more oxygen to get into your body so that you can perform better and faster and stronger while you're working out. So we're just going to do a quick little overview of the WCC services that we do offer. And then afterwards, you'll be able to ask as many questions as you like. So for WCC, you do have access to a nurse, a trained RN, 24 hours a day, 7 days a week. We also help secure insurance coverage through accident benefits as well as extended health benefits, which is something that not a lot of clinics are familiar with, but it's something that we specialize in. We do have healthcare practitioners that are able to assess for things like anxiety and depression for those that don't have current diagnosis information available. We do free education for patients, pharmacists, and healthcare practitioners. We are able to expedite our services for palliative care or serious cases. We are Canada-wide, so we can serve every Canadian in every province. There are no limitations to our service area. We are also telemedicine, so you can do your appointment from the comfort of your own home. We're also starting currently and a little bit more in the new year, online and in-house classes. And we do, of course, have our online support community for patients and those who aren't patients but want to know more about us or learn more about cannabis. So now I'm just going to open up the Q&A. So if you guys have any questions that you would like answered, I would be more than happy to do so now. So we just got a question, how do we contact someone for a consultation? So you can actually do so through our website, which is Women's Cannabis Clinic. You can also do so through our community. You can message any one of the administrators there and they'll be able to assist you. If you want to give us a call, I can give you the phone number as well. It's 1-844-312-5143, or you can get in touch with me directly. My email is Kirsten, spelled Kirsten, at medmc.ca, and we'll be able to help you determine if you are able to get a consultation for medical cannabis. And for anyone that is involved with the WCC community group, there are absolutely no fees for a consultation whatsoever. So we provide all of our services free of cost. Another question that we do get asked about is, how can I get coverage through my extended health benefits? So one thing that a lot of insurance companies are starting to do is open up healthcare spending accounts specifically for medical cannabis. So generally what happens is you do have to have an authorization for medical cannabis in order to get covered for it. So you won't be able to get reimbursed for your medical cannabis purchases if they are not through a licensed producer. So it's important to get yourself authorized. And then they usually have something called a prior authorization form. So they'll ask a little bit about what sorts of treatments that you've tried before, when you stopped them, why they were unsuccessful, how they were unsuccessful, those sorts of things. But after that's all filled out, generally what happens is they will open up that extra healthcare spending account for you. Just in case anybody doesn't know, but Veterans Affairs also covers up to 3 grams a day, and beyond that with a special authorization for veterans. And through accident benefits, your insurance company that you're involved with that's dealing with your accident in many cases, will cover your medical cannabis for you as part of your treatment, along with chiropractic and massage and those sorts of things. Another thing we oftentimes get asked is does my family doctor or nurse practitioner have to be supportive of my medical cannabis? And for our services, no, they don't. It's helpful if you do have a referral and we're able to get your medical file, but in some cases they're just unsupportive, and that's totally fine. That's definitely something that we can still work with. Okay, well, if that's it for everyone's questions, again, you can get in touch with me. You can call me directly at the clinic. The number again is 1-844-312-5143. And my name is Kirsten if you want to speak to me directly, or you are more than welcome to speak to any one of our administrators. Thank you so much for joining us this evening, and I look forward to speaking with you soon.